Quicker care for Texans who need prescriptions. That's what House Bill 3459 aims to do when it takes effect September 1st. Maggie Glenn explains how the bill aims to cut down the prior authorization process to get patients the treatment they need when speed matters.
If I order things like a CAT scan to evaluate my patient's breast cancer to make sure it hasn't spread somewhere else, frequently I have to go through an insurance company to make sure that they think that's okay.
Breast oncologist Dr. Deborah Patt says that prior authorization process delays her ability to treat and evaluate her patients.
Before they can get appropriate therapy and before they can understand how risky their disease is to them, they have to go through this process of waiting.
According to the Texas Medical Association, 8 in 10 Texas physicians reported having to obtain prior authorization for medical procedures and common prescriptions. 85% of them reported that process delayed patient care, ranging from days to weeks.
That can change a child with a urinary tract infection from a local problem to a septic illness that could be potentially life-threatening.
Now, House Bill 3459 gives doctors who have a 90% approval rating from insurance companies a gold card and allows them to skip the pre-approval process.
If you have prior authorizations that have been approved, and you have at least 5 of those in any 6-month period, then it gives you a rolling approval when you order the same study.
The Texas Association of Health Plans says those requirements aren't enough.
Having just this very basic sampling in a limited window of time, we can't have a good assessment if physicians are really prescribing care and treatment in good faith. And it's just an invitation for waste, fraud, and abuse.
But Dr. Patt says insurance companies are just trying to manage costs.
They're not in patient rooms giving care to patients every day.
Maggie Glenn for State of Texas.
The Texas Association of Health Plans says the gold carding process could lead to problems if a patient has more than one provider. For example, multiple doctors might prescribe different drugs that don't interact well together, which could lead to side effects. The association says an insurance company could catch a problem like that ahead of time, but doctors say patients can take control of that by fully disclosing all medications during their visits. Thank you again for joining us for State of Texas. I'm Josh Hinkle. We'll be back next week to bring you an in-depth look at Texas politics. Have a great day.